Boris Johnson's been defending his COVID policy on two flanks today. There's just, in the last half hour, been a Tory rebellion over the curfew rule. 44 Tory MPs rebelled, and those are people who don't like the restrictions as they've been laid out, want to lighten the restrictions, not intensify them. And as you said, there's one unpaid parliamentary aide who's resigned. That's not the sort of thing that normally happens, that size of rebellion or resignations like that this early in a parliament, showing he's in trouble on that flank. Keir Starmer has chosen this moment to turn around and say that he's switching Labour policy. No longer is he just standing there and saying, we don't think you're implementing what you're doing competently. He's saying you're actually making the wrong judgment call. And of course, there he's siding with the sage scientists. Governments don't follow every single letter of scientific advice. But the divergence between that scientific advice and what the government is actually doing is much bigger than we've known before. The Prime Minister's just been talking to Tory MPs, trying to calm them down in a Zoom call, and he said there that Keir Starmer his policy is swerving around like a badly made shopping trolley. Keir Starmer has certainly swerved over to the scientists tonight.
We're going to be driven by the science. We're going to be driven by the science.
The mantra, much repeated, is it now abandoned? Moments after the Chief Medical Officer, Chris Whitty, left the Downing Street press conference last night, his SAGE committee published minutes of a meeting 3 weeks ago in which they called for an immediate 2-week lockdown or circuit breaker. It would look a lot like the original national lockdown. The next day, Boris Johnson announced something very different.
This is by no means a return to the full lockdown of March.
And nowhere near what SAGE wanted. And even though SAGE said curfews were likely to have a marginal impact on controlling COVID, Boris Johnson went ahead and announced one.
Early closing for pubs, bars.
The government didn't want to shut down the struggling hospitality industry for a fortnight, as the scientists said should happen. The Labour leader decided now was the moment to side with the scientists.
Good afternoon. We're at a decisive moment in the fight against coronavirus. The government has not got a credible plan to slow infections. It has lost control of the virus, and it is no longer following scientific advice. I'm calling for a 2 to 3 week circuit break in England, in line with SAGE's recommendation.
The Labour leader said the 2 to 3 week lockdown should cover school half-term, but he hoped schools would reopen for part of it. In the Commons, the Health Secretary insisted that the government was taking scientific advice into account as it made decisions.
And then we make decisions that are guided by the science, taking into account all of the different considerations that we need to look to. Yes.
He found himself fighting on another flank as Tory MPs insisted the government's restrictions already went too far, not least the 10 p.m. curfew for pubs and restaurants.
The restaurants close, the pubs close. There is no takeaway available at 10 o'clock. And guess what? The first train out of London or the next tube at 10 is going to be rocker chocker solid.
The publican in the high street can comply with the rules and close at 10, but they're offering takeouts at 9:45, spilling out massive crowds of people. That's reckless behaviour, and I really do think the government need to just take stock.
We have to get the country back to work. We simply cannot go on bailing out businesses. We are going bankrupt.
The Labour leader said if Tory MPs wouldn't back a 2 to 3 week national lockdown, Labour MPs would help him win the Commons vote.
But if we act now, if we follow the science and break the circuit, we can get this virus under control. If we don't, we could sleepwalk into a long and bleak winter. Thank you very much.
Some in Labour are hostile to the policy shift. The Prime Minister, speaking to Tory MPs tonight, accused the Labour leader of playing politics with COVID.
Well, let's be joined now by Professor Stephen Riley of Imperial College London. He's specialist in infectious disease dynamics and is a member of SPI-M, the SAGE subcommittee on modelling. Professor Riley, let me ask you first whether your modelling supports the idea of a 2-week national circuit breaker lockdown as the Labour leader is calling for.
So the science behind what would happen is pretty clear. If we can if everybody complied with the circuit breaker in a similar way to how we've complied with restrictions earlier in the year, it would bring about a reduction in prevalence, and it would give extra breathing space. And above everything else, it would give us confidence that we did have an intervention that would work at this time. But I think right now, the most important thing is what's happening in the most affected areas. So while it is great to have this debate about a broader national policy, it's important we're not distracted from those most affected areas.
And in those most affected areas, where Liverpool, for example, where Boris Johnson has put that city and region into tier 3, what does your modelling say about that system and how effective that is?
So probably the evidence that I've worked on that's most relevant is our study of how many people are actually infected and whether that's been going up. So we've got really good data that shows up to 1 in 100 people in the northwest are currently infected. So what that tells us is that we can forget for a moment about the R value. There's too many people walking around infectious with the virus. That's going to translate into hospitalizations and deaths. So, the people that are living there need to take action to bring that down. And I think that observational evidence is by far the most important evidence that we've got right now.
But to bring that 1 in 100 figure down, is closing pubs for drinking only but keeping restaurants only, is that enough? Do you need to go even further? Do you need to look at closing schools, for example?
So closing schools, I think, is going to be the last item on any kind of a menu or agenda for restrictions. There is good evidence that the virus does spread in hospitality situations, in restaurants and in bars. And I think given the trend, given that we've had a little bit of a slowdown from these recent interventions, but it's not turned the epidemic around, then I think there is a really good argument for getting rid of that transmission.
But is it just tell me, I know your modelling focuses on the sort of health consequences, but is it justifiable to trash the economy for something that is causing, at last count, 3.2% of deaths in the UK at the moment?
It's not the restrictions that are trashing the economy. The virus is making it really difficult to manage our health service, and it's going to make our economy very difficult to manage for at least this winter. It's the virus that's very difficult to manage. For a short period of time, then I think it is reasonable. The hospitality industry has got to take a long-term view, and I think that if we manage the virus effectively over the winter, then there can be a really healthy long-term view for all parts of the economy. So it's not as simple as saying it's a trade-off like that. OK,
Professor Riley, thanks very much for joining us. Well, I'm now able to speak to Angela Raine, Deputy Leader of the Labour Party. Angela Raine, the government says that they're guided by the science, but they're also taking into account economic considerations. For you, for your party, does the economy come second in this?
Absolutely not, Kathy. I think that you have to look at the two combined, because if the virus is out of control, which is what is being suggested is happening at the moment, and we don't get control of that, then that would damage our economy. And the support packages at the moment are just not good enough. And that's what's happened in the north. We've seen the virus out of control and the government being 2 steps behind continually. And that's why we've called for a circuit break to make sure that we get on top of this virus now and sort out the testing and tracing system. And
what would that circuit break cost?
Well, the cost of not doing it is that it'll cost us more in the long run, because as we've seen with these businesses that, we're coming up to Christmas time, and if the virus is out of control, which is what's happening at the moment, in my constituency, we've been in lockdown now for 10 weeks and it's not made the difference it needs to make.
But have you costed the circuit breaker, the 2-week?
The circuit breaker 2-week would be a lot less than what it would be for this virus to go out of control.
Have you costed it? I'm just not hearing a figure.
Because what I'm saying, Kathy, is that the cost of this, if we don't act, will be more than any figure that we put on that. And the government, at the beginning of this virus outbreak, took the steps that they felt were necessary by making sure that we had that lockdown. The science advisors now are saying that we need to have this circuit break to get on top of this virus and to give businesses and individuals the support to do the right thing so that our NHS can cope and that we can get through this and get that R rate down.
I just just wonder if your own party is behind the leader and yourself on this, because when you look at the 5 Labour MPs in neighbouring seats to yours in Manchester, saying that they said that putting Manchester in Tier 3, which is less onerous than the full lockdown that you're asking for, they said that, quote, would have a devastating impact on jobs, livelihoods and businesses. The Labour council leaders of Leeds, Liverpool, Manchester and Newcastle wrote a letter saying, we do not support further economic lockdowns. Have they got it wrong, or has Sir Keir?
Well, the Tier 3 that the government were introducing was, first of all, without the financial support that would be adequate, and there wasn't an end to it. What we're saying is a 2 to 3 week circuit break will give us the opportunity to get the test, track and trace in local supply, so that we can get on top of where the virus is, that the businesses and individuals are given the support that they need, and that we can get on top of the virus. A circuit break is different to Tier 3. The current Tier 3 that the government is offering is keeping people in poverty, and is not doing what is required for those businesses.
But it's not just about financial support in addition to a local lockdown. These Labour leaders, council leaders and MPs, they say they don't want further economic lockdowns. They don't even want a 10 p.m. pub curfew.
Well, I was on the phone on a Zoom call earlier today with Andy Burnham, the Greater Manchester Mayor, and leaders in the Greater Manchester, and I'm of course a Greater Manchester MP. And what we're saying is we need people to be given the resources to do the right thing. We're listening to the advice from those SAGE and those scientific advisors for the government, and they're clearly saying what the government is trying to introduce is nowhere near enough to get on top of this virus. And we're saying that the government need to act now and not be behind the curve again, not be slow at the wheel, and to do something now to make sure that those businesses going into Christmas are not in these restrictions in the way that they're going to have to be because the government fails to act now.
Isn't it quite easy to sit there in opposition and make these calls? Isn't there an element of opportunism that, in a few weeks' time, if there is another national lockdown that the government decides to go for, you can just turn around and say, told you so, we called for that a few weeks back?
No, Cathy, and in Greater Manchester, in my constituency, my hospital is already going up. Members of my own family are in critical care at the moment with COVID. So, the personal sacrifice that people have made and the difficulties that we have, we take no pleasure in saying to the government that we think they've got this wrong. All we're doing is saying to the government, do what needs to happen now to support our communities, to help our NHS, and to listen to the scientific advice to keep people safe. The measures that the government have announced yesterday are not going to do that, and that's what the science advice is saying, and that's why we've made this intervention today.
Just before you go, I'm sorry to hear that members of your family are in critical care. Are you able to tell us some more about that?
Well, my auntie's not well at the moment. She's in a hospital in Greater Manchester with COVID symptoms and is not very well. And I think lots of families at the moment are going through exactly the same thing and are really worried about their loved ones and worried about their businesses and worried about their jobs as well. So I do know that people are worried about this. And what we're trying to do is insist that the government follows the advice of their scientific advisors and do what's right to protect lives, help our NHS and to keep our businesses going through this pandemic.
Angela Raine, thanks very much for joining us.
Thank you.
Well, turning to Northern Ireland now, where the local council area for Londonderry and neighbouring Strabane has the highest level of cases of COVID in the UK, with over 900 per 100,000 of population. The Northern Ireland Executive is expected to announce a series of new measures shortly. Fatima Manji joins us now from Belfast. Fatima.
Cathy, there's been a lot of chatter all day suggesting that Northern Ireland could become the first UK nation to impose a circuit breaker lockdown, as of course recommended by SAGE 3 weeks ago. The weekly meeting of the Power Sharing Administration has been brought forward from Thursday to today. That's due to begin at Stormont shortly. Just to be clear, that's not going to be a straightforward discussion, though. We understand there is disagreement about what should happen next. The DUP are said to be reluctant to bring in further restrictions that involve a second lockdown, while Sinn Féin do want to bring in stronger restrictions. We're also hearing from a DUP source tonight that there is to be a special sitting of the Assembly later this evening, so we may yet hear from Arlene Foster later tonight. If they do go for a circuit breaker lockdown, there is a question also about how long that will be for, because the advice from the Chief Medical Officer and Chief Scientific Officer here in Northern Ireland is that it should be for 4 to 6 weeks. And it's believed that they have the backing of the health minister on that, who has also recommended that schools should close. So we're talking about some quite drastic measures. But the statistics, the case numbers here are quite sobering. You mentioned Derry and Strabane. They're looking at 971 cases per 100,000. To put that into context for you, the UK government brings in quarantine for any country, looks at bringing in quarantine for any country that has 20 cases per 100,000. The other bit of information that's worth bearing in mind is that people in Northern Ireland are already facing quite a lot of restrictions. They're not allowed to invite other people into their homes, and they can only go to pubs and restaurants with one other household. If those restrictions are in fact ramped up, is that effectively going to be an admission that restrictions on household mixing are simply not enough to slow the spread of this virus?
Fatima, thanks very much. John.
Our health and social care editor, Victoria MacDonald, joins now from the newsroom. Victoria, so who is right, the government or the scientists in all this?
Well, what we've had, John, all the way through this programme, you can see is that tension between the government and the scientists. And it's not just in England, it's not just in Northern Ireland. I think it is across the world as different governments struggle to contain this pandemic and to do the right thing. The problem with what's happened in England is that we are repeatedly told, as you have heard through this programme, we are following the science. And what we have seen following the publication of those SAGE papers is that they haven't followed this request for a circuit breaker, a hard, sharp lockdown. And what it looks like really now is a government that is doing a sort of pick and mix approach to the following the science, taking some of it that they want and rejecting some of the rest of it. But even as Angela Raine was saying, and as others have said, there is also that tension between the economy and saving lives. But I think what is becoming more critical for the government is trying to find out, reach that balance about what the public will in the future tolerate.
And Victoria, we've had some new rules announced for vulnerable people today. What are they?
Well, this comes back to public toleration. Now, we know that in the first wave, they locked down, they shielded large numbers of people. Today, they have said they're not going to do that shielding again, but for the particularly vulnerable, those who've had, say, organ transplants or are having chemotherapy, it's about 2.2 million people in England alone. They will be told instead to follow the tier rules, the medium risk, the high risk and the very high risk, to do what's required of them there. But say, let me give you an example. For medium, they will also be told to observe social distancing, but to go back to work and school. Now, some charities have said, in fact, the problem with that is that people might be feel like they're forced to go back to work when they would be rather shielding. Again, though, it is the government having to look at the mental health implications of putting people behind closed doors again. They don't want that to happen again, while also protecting the economy and protecting people's lives.